Complications of sickle cell disease, part 2. In the first video, we covered splenic crisis, acute chest syndrome, hand-foot syndrome, and organ damage. In this video, we will be learning about the others. Blindness. Sickle cell retinopathy is present in some patients with sickle cell disease. In sickle cell retinopathy, blockage of blood vessels in the retina result in abnormal blood vessel growth and thinning of the retina. These physical changes and their consequences can impair vision. Sickle cell retinopathy can affect several parts of the retina. Pause to read this. Pain crisis. A sickle cell crisis is pain that can begin suddenly and last several hours to several days. It happens when sickled red blood cells block small blood vessels that carry blood to your bones. You might have pain in your back, knees, legs, arms, chest, or stomach. The pain can be throbbing, sharp, dull, or stabbing. How often and how bad the pain gets varies a lot from person to person and from crisis to crisis. You might be able to treat your pain crisis at home with medicines that you take by mouth. If these medicines can't control your pain and you can't keep fluids down, or you know that you're having severe pain, you might need to be treated in the emergency department. If your pain still isn't controlled or you have other problems, you might need to be treated in the hospital. How can I prevent a crisis? These are ways to prevent a crisis. Take off your medicines, drink water, get rest, avoid extreme temperatures. You can click on this card in the corner to watch a video that is strictly pertaining to parents and taking care of your child with sickle cell disease. Or you can just wait to the end of this video, go to my page and watch it. Talk to your doctor about what activities are right for you. Stay clean, stay away from sick people, get all your recommended vaccines, don't smoke, drink, or use drugs. A child who has sickle cell disease should be under a healthcare provider's care, but parents can do many things at home to reduce symptoms and maintain the child's health. Stroke. Sickled cells tend to stick together, and they can't move easily through blood vessels. They can come together and block blood vessels. This can lead to a clot forming and moving to the brain, causing a stroke. A stroke can also be due to damage to the blood vessels in the brain caused by sickle cell disease. The common stroke in children with sickle cell disease is silent strokes or silent injury to the brain. This may occur in up to 39% of children by the age of 18. Silent strokes do not have any outward physical signs such as arm or leg weakness, but can be seen on an MRI of the brain. Silent strokes may cause problems in thinking, learning, and decision making and are a risk factor for future strokes. What you can do as a parent. Work with your child's doctor. Determine if they need annual stroke screenings, which my daughter gets one, which is called a transcranial Doppler ultrasound. I do have a video on how that goes. But work with your kid's doctor all the time. Just do what needs to be done for them. Also, learn the signs of stroke. Symptoms of stroke are similar in people with and without sickle cell disease. Use the acronym FAST to remember the warning signs of stroke: face drooping, arm weakness, speech difficulty, time to call 911. If it looks or feels like a stroke, it may be one. Other stroke symptoms include sudden onset of confusion, headache, numbness, trouble walking, and vision problems. Learn more at stroke.org. And the last one for today is Priapism. In a child with sickle cell disease, the sickling of red blood cells can cause an erection. Blood is unable to flow out of the penis because the vessels are blocked by sickled blood cells. If the erection continues, this is called priapism. Priapism can be very painful and is a serious condition. I have a daughter, so this one I won't have any worries about, but if you do have a son that has sickle cell disease, then you can learn more about this.